Oops. Hey guys! Hey, Edward Payak, how are you? Kumusta po? Tagal na ako hindi ang tawag dito, nag-live. I think it's been like almost 2 months. Pero anyway, so yung question mo regarding minoxidil and finasteride. So, ang gamit kong minoxidil is ano siya, Life brand. So basically ano siya, popular, cheaper, parang murang version siya dito sa Toronto. So pakita ko sa iyo yung brand na gamit ko. So ito 'yon. So actually, kakabili ko lang nito kanina. This is my third bottle. So this is my second month. 2 buwan ko na 'tong ginagamit. So far okay naman. Medyo I don't know, parang may hair shedding nga siya nangyayari. Alam mo 'yon, like after a month, parang medyo nag-aano yung hair mo. Pero normal lang 'yun. So wala namang problema doon. So expected na 'yon. So tumatagal 'yun mga usually hanggang at least like a month or so, depende sa kung makapal pa yung buhok mo, di ba? But so far okay naman, wala akong problema. 2% solution tong gamit ko. Tapos yung finasteride is ano siya, generic brand siya. So direct siya sa pharmacy dito sa Canada ko siya nabili. Okay, so with prescription to, kasi finasteride is always with prescription, di ba? So, yeah, so far okay naman yung minoxidil tsaka yung finasteride together. Pero mas nauna kasi yung finasteride, 2 years ko na tong tinitake. So, yeah, again, ito yung box niya. And that's it. Yeah, magkano to? I think mga $45. So, sa Philippines, mga 2,000 or something. Yeah, mga ganon. So, yeah, okay naman siya. Pero ang result kasi ng minoxidil, aabutin pa ng mga at least 4 to 6 months. Generic na, yeah. Diyan kasi sa Philippines, ang pagkakaintindi ko, like my understanding with finasteride is kailangan mo rin yata ng prescription. Right? So, yeah. Pero meron yatang ibang nakakabili ng finasteride nang walang prescription, di ba? Pero dapat hindi. So, yung sa akin with reseta ng doktor. So, kailangan kasi talaga siyang ma-monitor ng doctor for the first 3 months kung merong result or wala, di ba? So, ako, minomonitor ako ng doctor ko kung chine-check niya lang kung may improvements yung hair ko or may side effect, yung ganun. So far, okay naman siya, walang problema. So, I'm happy with that. By the way, thanks for your message. Yeah, so gumawa ako nung video about second year of using minoxidil after finasteride, after 2 years of using finasteride. So pinost ko yun. Okay naman, so far maraming mga nagtanong doon na tungkol doon sa kung effective ba or yung mga ganun. But so far, pinahuli ko talaga yung minoxidil. Hindi ko siya pinagsabay sa finasteride kasi baka magkaroon ng problema or anything like that. So far, okay naman siya. Nag-focus lang talaga ako sa finasteride para mas, alam mo yun, para mas bumaba yung hormones na nagko-cause ng hair loss, di ba? So, nung stable na siya, doon ko na siya ginamitan ng minoxidil. But so far, okay naman. I'm very happy about that. Hey, Jubes! Long time no see, girl. Yeah, thanks for the message. And I know sa Philippines medyo mahirap kasing makakuha ng mga finasteride and minoxidil products. Unang-una, it's pretty expensive. Kasi nung umuwi ako ng Philippines, nakita ko, I think, nasa, kung hindi ako nagkakamali, almost 4,000 ang minoxidil. And that is a Rogaine brand. So right now, ano ngayon dito sa amin, it's 9 o'clock at night. Yes. Oh, I know, right? So, 1K, walang atrasa na yun. Dire-diretso na yun. Tiningnan ko. Nasan si ano? Nasan si Kirk? Wait lang. Binuhay ko yung electric fan. Medyo mainit. Jubes, pakinig ba yung ano? Pakinig yung music. Naglagay ako ng background music eh. Okay lang ba? Is it working? So guys, by the way, I got a new minoxidil product. Well, not new. This is my third box, so I'm so happy that I got this one. I don't know if it's working good. We'll see. Okay, I'm on my second month only, so usually minoxidil works after 4 to 6 months, depending on the severity of your hair loss. So we'll see how it is. I don't know, but so far I don't have any side effects with this medication. Okay, so I'm very happy with this minoxidil. So this was my second bottle. So yeah, I'm thinking that this will last until tomorrow. I don't know, but so far it's good. Yeah, with what do you call this? With finasteride, I think it's really one of the best medication. Well, it is the only proven medication, right, for hair loss. But so far, it is one of the best, really, to gain your hair back. As long as you are not in that almost, like completely bald, if you still have hair, and using finasteride for a couple of months, for 3 months, you'll see a big improvements, and there's a high possibility that you'll still get your hair back as long as you start early. So I started the medication back in 2000. When was that? 2020, I think. And just loving the result, guys. Loving, 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 loving my hair. Love it. Yeah, it works really, really good. And yeah, basically, I just decided to do a quick, I don't know, maybe after an hour, I'll stop this live. But I just wanted to share with you guys that yeah, it's been 2 months of using minoxidil, and so far I don't have any irritations on the scalp or things like that. And I just wanted to share with you guys the new in the product that I'm using. This is not the most expensive one. This is like around $45. The Rogaine one is actually very expensive. So I don't know. I cannot afford that right now. So I'm just using this one for now. Okay, but um, I might increase the dosage from 2% solution, because this one is 2% solution. So I might increase it to 5% after 6 months or something like that. As long as I see the improvements, I mean, after I see a good improvement, then I will increase the dosage. But as of now, I'll stick with the 2% solution. So I'll put down the dosage of the minoxidil that I'm currently using right now, or the percentage. So currently I'm using the 2% solution. Okay, and this is actually a spray. This is the one. So this is a spray, guys. Okay, so far I don't have any issues with this. I really like it. It doesn't have that. It contains alcohol. So yeah, hopefully that for those people who's planning to use minoxidil, hopefully that you guys don't get any side effect like scalp dryness or itchiness and things like that. But once you guys experience that, you can stop the medication and consult with your doctor if it's actually a severe um, side effects or things like that. How much is the finasteride in the Philippines? Hey Tanli, how are you? I'm good. I'm good. I'm good. I'm good. Thanks for your message, by the way. Other mates? Oh, they're in their rooms. They're busy. You know, they're busy with their stuff, with their things and whatever. Yeah. What do you call this? Yeah, they're busy with their school works and stuff like that. My brothers, they're downstairs. I'm just having a problem with my. Are you guys currently on a thing? What do you call this? Are you guys currently on finasteride? Whoever. And so far, how is your experience with this medication? Somebody asked me about dutasteride. I mean, I'm not so familiar with dutasteride, but I've seen dutasteride medication. It's actually on a zero point 0.5 milligram dosage. Dutasteride is actually also a DHT blocker, but I don't think it is approved for male pattern hair loss as of now. But I've seen these medications a lot in my workplace. We always give this to the elderly for benign prostatic hyperplasia. So they both work the same way. I think in US, the tasteride is prescribed also for hair loss, but I don't see it in Canada. In Canada, it's finasteride 1 milligram for male pattern hair loss. So yeah, but my understanding with dutasteride is it's much stronger than finasteride. It blocks certain types of DHT, so it's pretty effective. But I don't think it's being prescribed here in Canada yet. It's most commonly for benign prostatic hyperplasia for BPH. But so far, yeah, for now it's 1 milligram only, of course, 1 milligram only for finasteride. You know what, guys? I am thinking and I'm considering to have PRP treatment. It's very expensive. So platelet rich plasma is basically it's a nice treatment actually. It's done in doctor's office. So what they do is they will take a blood from you, they'll centrifuge that, and then they'll take the plasma. So the plasma, they will inject it in your scalp, and that plasma, it has like growth factors. It'll help boost your hair. It helps to grow your hair and things like that. It's strong. It just helps to rebuild damaged hair follicles and things like that. So I think it's good. It's a good support treatment, but I kind of I think it's better to have that treatment when you're already on finasteride. But if you're gonna use that as a your primary treatment, um, I don't think it would do much because it doesn't block the main cause of male pattern baldness, which is DHT, right? Platelet-rich plasma does not block DHT, so you really have to take the medication first before you can have that injected in your scalp. So some people, a lot of patients, they are recommended to use also the minoxidil after having the platelet rich plasma. So it's actually a very effective treatment, and I'm planning to do that. You have to actually get your boost. What do you call this? The injection after 6 months. So, for example, if you get your injection today, you have to wait for another 6 months to get another set of treatment, which is it's just to help boost. It's pretty pricey. I think for the whole scalp, it costs like around $500 to $600 per treatment, and so far, the what do you call this? The dermatologist that I know, he said it's very effective, and I think a lot of people are trying it. So it's called platelet rich plasma. So maybe you guys can go and check it out at your own time. Check out the treatment. It's really nice. So it's a good conjunction with your finasteride treatment and minoxidil. But for now, I'm really happy with my minoxidil and with my finasteride. So I'm gonna show you guys what's in the box. So first of all, let me tell you that this is a 2% solution. Okay, we do have 2% solution and also 5% solution. The 5% solution, it's a little bit too strong for me. I think I'm gonna start with. I haven't tried 5% solution. Okay, sorry. I'm gonna start with 2% solution for now, and then after 6 months, I will see how it goes. If I will get an improvement with 2% solution, then I would go ahead with the 5% solution. So I'm gonna show you guys how it is inside. By the way, um, this is my third box. So there you go, guys. I'm gonna show it. Can you guys see? So there's a booklet, and by the way, guys, it shows on the back that can you guys see? So if your hair is like this, if the balding is like this, it's okay to use it. But when it gets to a really, sorry, I cannot focus it. There. So when your hair is actually really bald and it's shiny, this thing wouldn't work because really minoxidil, what it does, it makes your existing hair thicker. Okay, and it also makes you grow those baby hair, which I think I've seen a lot I've seen in my with finasteride. So very very good combination with finasteride. So I'm gonna show you guys what it is inside. So there's the solution. Can you guys see? So that is the solution. It's 2%. By the way, guys, this one is originally, it is a blood pressure medication. So before, it comes in like I think a capsule or a tablet. So this is for the treatment of high blood pressure. But they noticed that people who's taking it orally, they grow hair, okay, like all over their body, and that's why they come up with the idea to probably use it for topical. So topical is very very effective for hair loss. Okay, and another thing is it comes with this one over here. So what's in here is it's really nice actually. I haven't used them because I'm only using one kind of so there it is. Can you guys see? So first we do have this one. This one is really cool. So what it does is you put it on the, what do you call this? You put it on this because I'm using the spray one. Can you guys see? So this is the spray nozzle or whatever you guys call it. And then this one, so if you change it to this, what's really good about this is this one is very concentrated. So as you can see, there's like a little hole at the front. I don't know if you guys can see it, but you can just go and do it like this. So the solution is very much concentrated, but I choose to have the spray because the spray is much more wider when you spray it. So I prefer that one. They also have the, what do you call this? This one over here. So, oh, this one is the spray. Oh, wait. This one. So this one is like for specific area. Can you guys see? Right there. So this one is like very much more concentrated. So if you only wanna improve your hair on this side, then you better use this because it's you'll spray it directly on that area. But so far, I chose to use the spray one. It's better for me. At least it's it's good for most of the, like, for the whole. It has a good coverage, I should say. So there was one there's this one guy. He actually asked me if why not take the oral tablet of minoxidil if the side effect would be, to have more hair and things like that. But the problem is, oral minoxidil is only specifically for blood pressure. Okay, I wouldn't recommend taking, oral minoxidil. And besides, I've never seen oral tablets of minoxidil. There's a lot of blood pressure medications that I have seen in the hospital, but I've never seen minoxidil like capsules or tablets. Maybe in, like, I don't know, depending on the doctor if they would prescribe it. But I've never seen minoxidil medication orally. Like, really, I've never seen it. So yeah, but so far I'm happy with the result of my minoxidil. Are you guys using minoxidil or finasteride right now? And guys, don't expect a miracle with minoxidil, okay? Minoxidil works very, very slow. Like as I said earlier, it takes at least 6 months to see an improvement to a year, depending. Like, I'm thinking that for myself, it would take much more longer because I'm only using this every night. Um, I shouldn't say it's supposed to be twice a day, but I just prefer to use it at night because during the day it's I go outside, I go to work, and I just want this to stay in my scalp for like a longer period of time. Like, yeah. So, but so far I like this. I really like this 2% solution. I don't have any side effects with this, like itchiness or things like that. I just noticed that my hair, they fall out, like, no, I shouldn't say a lot, but I think that's one of the thing with minoxidil, that you will really stimulate that hair follicles and you'll end up growing a better hair because you're pushing the old hair out. That was the thing that I experienced with finasteride when I first took this medication. Like after 3 weeks of this medication, I was having like so much hair shedding and things like that. So, you know what I mean? So guys, let's talk about the I've been receiving a lot of message from TikTok, not TikTok, sorry, from Instagram and from what do you call this? From YouTube regarding the what do you call this? Now I forget. Oh, the finasteride. If you really need a prescription, I always tell them that you do need a prescription with finasteride. Kailangan talaga ng prescription with finasteride kasi um, hindi mo alam baka may medical conditions ka or things like that that your doctor needs to reassess, right? So yeah. Even with minoxidil is an over-the-counter medication, pero I still highly advise na magpa-consult muna kayo sa doctor nyo before you buy a minoxidil, because minoxidil is still a medication with side effects. So just to be on the safe side, okay, guys? And yeah, so today is July 6th, 9 p.m. dito sa Toronto, Canada. So guys, in the Philippines, it's morning. Good morning. If you guys are new to my channel, welcome again. My name is Moe. This is a very late introduction. I've already started the video. So welcome, guys. I do a lot of nursing in skincare and hair care. So what I do is I involve nursing with skincare and hair care. I think it's good in some ways. You know, I'm not a dermatologist. I'm not a chemist, but I think as a nurse, it's very important to tell my viewers and or the my friends, my families, that certain things has to be done with a supervision of like a medical profession, especially your doctors and your dermatologists. Correct? So, like say for example, minoxidil. Let's talk about. Anyways, this video is about minoxidil. Like say for example, minoxidil. A lot of people would go and buy this over the counter. So for me, I'm thinking. Um, I think it's very important to tell you guys that even though it's over the counter, it's still very important to see your doctor just to have a good assessment, because minoxidil works with all types of hair loss, but it works better, I think, with genetic hair loss, right? Um, but there are times when a lot of people, kapag meron silang hair loss, they would run to the pharmacy, they would run to the health store and buy different kinds of like herbal medicines, um, or supplements and products without consulting their doctor. They don't know, or you don't know, if your hair loss is really related to genetics or hair loss. It could be you're having an anemia, or anemia, thyroid problems, diabetes, and things like that. So those medical conditions also contributes to hair loss. So it's very important to be guided and whatever, talk to the doctor. And hold on, is the messages working? I don't know, let me see. Let me see. Do you guys have any specific questions regarding the minoxidil and finasteride? Feel free to just ask me in the comment section box. Guys, thank you so much for coming in and for joining and things like that. It's my off today. Today and tomorrow I'm off. Yesterday, I worked actually for 12 hours, and it was a good shift. I wouldn't say it's really stressful, but the day before that, it was really um, sobrang nakakapagod, like nakaka-burnout, sobra. But it's okay. That's part of working, right? And complaining is not a good thing. But yeah, I enjoyed. So, um, what else should we talk about? What else I want to share with you guys? Oh, by the way, as I said, I use this at night, and in the morning, I use this one over here. Can you guys see? So this is the Sika peptide anti hair loss. I did a lot of like I did a lot of videos about Sika peptide anti hair loss. I really like this so much. Um, this one is a herbal tonic, of course. And this one has salicylic acid. I really like it because it really, like whenever I use this, it helps to, it has that cooling effect, and then it helps to exfoliate excess dead skin cells and things like that. So I use this in the morning. So at night I wash it, and then I put the minoxidil. So for me, I think it's a good combination just to help with absorption of minoxidil. And then of course I use my Hair Max laser comb, um, just to help with absorption and things like that. And if you guys haven't seen my video on the anti-hair loss shampoos and conditioners that I use together with my finasteride, feel free to watch it in my it's in my playlist under hair loss journey. So thank you guys so much. I'm currently drinking my tea. I love drinking my green tea at night. Usually after I eat like oily foods and stuff like that. And actually, somebody asked me in one of my video regarding green tea if it helps to regrow hair and it helps to blocks the HT. Um, what should I say? There's some studies, I guess, but it doesn't promote hair growth. It doesn't really block DHT. Or there are some studies, but I wouldn't really consider that as a well evidence based studies. Green tea is good to support your immunity and things like that. It's good part of your drinks, and but it's an antioxidant, so I would say it's good for you. If you guys wanted to know, this is the green tea that I'm drinking right now. So I got this one here in Toronto. You can use this in both cold and hot water. So I like that one. It's good. Yes. So are you guys what do you call this? When I went to the Philippines 2 years ago, was it 2 years ago? Yeah, it was 2 years ago. I saw a Rogaine product at SM department, and I was very surprised how expensive the product was. I think it's like 3 or 4 thousand for a bottle. So this one is only like $45, okay, which is like I think 2,000 something pesos. So that's an expensive product. I mean, in Philippines, everything is expensive. Yeah, yeah. So there's this side effects that actually it's part of one of the side effect of minoxidil is irregular heart rate and or palpitations because it's a blood pressure medication, right? But guys, don't worry, it's topical, meaning na nilalagay lang siya sa ibabaw ng scalp mo. It's like you put it on top of your scalp. It doesn't really affect systemically so much. Okay, so don't be scared about that. Anyways, you're only gonna be using this in like on the parts where you really need to stimulate the hair follicle. So don't be so worried about the side effects such as heart palpitations or irregular heart rate. You're not taking this orally, okay? So it's a safe medications, okay, guys? If you take the minoxidil orally, then I would be concerned about the side effects such as dizziness. What else are the side effects of like blood pressure? Side effects like a feeling of faintness, regular heart rate, low blood pressure, things like that. But you guys are not taking this by mouth, so you're safe. Okay, guys. So I'm typing something here. Let's just put something like this. There we go. So guys, I don't know why I'm still getting a lot of message about, but I don't mind answering it like all the time. but I've been getting a message asking about 5 milligram if it's really possible to cut it in four and take it. Guys, I don't recommend you guys cutting the 5 milligram of finasteride to four pieces because that would be 1.25. I consider that as overdosing. Ang dosage talaga ng finasteride, guys, is really 1 milligram for 1 milligram for daily for male pattern baldness. Yun talaga, guys, yung standard. Pwede mo siyang hatiin to 0.5 milligram. That's okay. But 1.25 milligram, I consider that as a little bit of an overdosing. So, kailangan mo talagang you really have to see your doctor for 1.25 milligram. That is an overdosing. And I don't consider, I don't consider you guys cutting the 5 milligrams into to 4. So, if you guys want to see how my finasteride looks like, I'm gonna show it to you guys. So, this is it. Ano siya? It's small. It's very tiny. So, you guys wouldn't have any problem. It's small. Can you guys see? Yeah. Anyways, there you go. It's tiny. So I take this every morning. And by the way, I know that you guys wanted to know what is the best time to take finasteride, and does it affect like what time? Finasteride is to be taken daily. So regardless, that doesn't matter. If it's daily, you can take it within of course, the day. I prefer to take it during lunchtime because that's the time when I eat a lot. You know what I mean? And it doesn't really affect the absorption rate. So even if you wanted to take it at night before you go to bed, that's fine. With or without food, that's okay. And let's answer some questions over here from Juve de Gracia. She's asking, is it okay sa mga old people like more than 60 years old? Finasteride is okay. Very much okay. But a lot of times, you will notice that 60-year-old men, if their concern is hair loss, usually with 60-year-old men, based on my experience, I've seen them with not so much hair. So a lot of times, only this part here, they only have, itong part na to ng kanilang head ang may hair, except for this one. So, with taking finasteride, you're thickening. So, kakapal lang yung part na nandito and here, but not here. So, if meron kang isa doon na buhok, if you have one tiny hair on that spot, you're thickening that one hair, but you won't be growing hairs. You know what I mean? So, I just want to clarify. Okay. But if you're young, if you're on your 20s and you're noticing hair loss and you have seen your doctor and your doctor had recommended you to take finasteride, the chance of regrowing your hair is very, very much high. So you'll still grow your hair so much. Like me, I started using finasteride when I was like 28, and my hair I would say it's better now. I like it. And by the way, I cut my hair the other day, and now it's much thicker. There we go. And you know what? You know what I noticed with finasteride? It actually makes my hair a little bit thicker. Hi, Eric. Eric, sorry, Earl Kenneth Sumok. Hello. How often do you use minoxidil on a daily basis? Okay, so welcome. With yung minoxidil ko, I use it only at night. Kasi sa morning, I'm very busy. You know, I work in the hospital and I kind of, it's the environment is just dirty and it's I sweat a lot. So what I do is I only use it at night before I go to bed. In the morning, what I usually do is I use the Cicapeptide anti-hair loss. Can you guys see? Sorry, medyo hindi ko ma-focus. So, Cicapeptide Anti-Hair Loss. This is a Korean brand by Sambani. This is my third bottle. So, ang technique na ginagawa ko, my strategy is nilalagay ko to in the morning because this one, hindi siya oily, hindi siya sticky. And this one has salicylic acid which is very good for exfoliating. Tapos, piniprevent niya yung oiliness ng scalp. And then, At night time, before I go to bed, I use this one. And I think with Peptide anti-hair loss, it helps with the absorption of products very well kasi nga meron siyang salicylic acid, and salicylic acid is a proven ingredient. Actually, it's being used for I don't know how many years, and it's good for exfoliation ng scalp. So nakahanap ako ng good combination. I found a very good very good combination with these two. Some people, they use this in the morning and at night. That's okay. You can do that. Just my own choice and my own strategy that I would use something with salicylic acid and then minoxidil at night para the absorption is better. Yun ang sa akin. And then I also used my laser comb. If you guys haven't seen my laser comb, I will show it to you. So that one, I use it 3 times a week. Sorry guys. So this is the laser comb that I use. Ano siya, actually very effective siya. So what I do is, after I use this, after ko siyang spray sa buko, I cover it, and then I wait for like maybe half an hour just for it to sip in. And then gagamitan ko siya ng laser comb. So laser comb, of course, laser siya. And then igaganon ko lang siya sa buhok ko all throughout. And then yun na yun. And then I use this 3 times a week, but this one every night. Sometimes nakakalimutan ko, but it's okay. This is my third bottle, by the way. So I'm very happy with this one. Mahal lang ano, di ba? Ang minoxidil sa Philippines. Kasi yung nakita ko sobrang mahal. And guys, by the way, I live here in Canada, so like I've been here for like 22 years na. Okay, so uuwi ako ng Philippines this October, and I'm very happy. I'm very excited about that. And just to see my family, my grandparents, my cousins, and yeah, I'm staying there for a month. And let's see how it is. I'm so excited. So yeah, guys, Minoxidil Life brand. We do have a lot of different kinds of brands ng Minoxidil dito sa Canada. Kasi grabe guys, as in ang dami talaga ng nakakalbo dito sa sa Canada. I don't know why. I think it's because of it's very stressful here. Kasi yung mga tao dito, trabaho lang sila ng trabaho. Sometimes they don't have time to eat properly, to take a rest. A very stressful life. I think mas madaming napapanot or nakakalbo na Canadians or Americans compare sa mga Asians, especially in the Philippines. But I think now in the Philippines, balding, like male pattern and female pattern baldness is becoming very common. And I think it has something to do with, of course, na-stress din, and then yung genes and things like that. So, yeah, guys, thank you so much for sending me or leaving some comments in there. And if you guys are new to this channel, welcome again. My name is Molly, and I do a lot of nursing in skincare and hair care videos. Alongside na yung finasteride experience ko. And guys, don't worry, I will always keep you guys updated with my finasteride, minoxidil, and things, all the new products that I will be using for my hair. I will give you guys an update on that. So I hope I answered your question, Earl, Kenneth, Sumok. Medyo advanced kasi ang dito medyo advanced ang treatment ng hair loss. As I said earlier, we do have the platelet-rich plasma. I don't think platelet-rich plasma is common sa Philippines. Okay, and I don't know. Wala pa akong masyado nakikitang platelet-rich plasma sa Philippines. That treatment is they take blood from you. Kinukuha nila yung dugo mo, tapos kuhanin nila yung plasma, and then i-inject nila sa scalp mo. So, I think meron na medical group, maybe IV, I don't know. Kalayan siguro. But guys, don't do the platelet-rich plasma yet, um, habang hindi kayo nagpi-finasteride, make sure na nakapag-finasteride na muna kayo. Okay, guys? That's actually a very good question. You know, with transplant, guys. Okay, let me tell you. Transplant is, I would say, the best treatment. But the only problem with transplant is napaka-artificial niya. It looks very artificial on your head, of course. Kasi what they do is they take the hair from the back of your head. Because this part of your head, I mean the hair on this side, they're resistant to DHT. Yung nandito, very sensitive sila sa in the Philippines. They have really good dermatologists or surgeons in the Philippines. But yung transplant, mas maganda kung talagang wala ka ng hair dito. Kasi the tendency is kung may hair ka pa, tapos magta-transplant ka, manlalagas din yun eh. May kakilala nga ako eh na nagpa-hair transplant, and this was back in this was back in 2002. One of my uncle's friend, he got a hair transplant. I don't know, probably back then the hair transplant treatment was still bad. But nagmukha talaga siyang buhok ng mais. Like hindi talaga maganda, guys. Ngayon ang dami ng treatment for hair transplant, right? Mas advanced na siya and it's less painful, less recovery too. Noon months you're still suffering from pain and things like that, but now after 2 weeks siguro you can go out and enjoy your but of course the hair will still it'll still improve for the next 2 to 3 months or things like that. And usually with hair transplant, if you get a hair transplant, you still have to take your finasteride. Like that is a must. And then nowadays they use laser. So after your hair transplant, you go to a session of on top of your scalp para yung recovery is much faster. Kaya nga it is better to start finasteride when you're early so you don't have to go through um, the surgery part of yung hair transplant na yan. I really want to talk to somebody who had gone a hair transplant. Yun nga, yung uncle ko, but the thing is, my uncle's friend, ang problema naman is, ang pangit talaga ng sibol. Tapos ngayon wala na rin siyang buhok. As in, ubos na rin. And he spent like so much money for hair transplant and then after 20 years, wala rin talaga natirang buhok sa kanya. That's why it's very good to start your finasteride early. So after 10 years, 15 years, mai-save mo talaga yung hair mo. Diba? And with hair transplant, you really have to go to a very good doctor. Wag yung kung saan-saan lang sa, 'di ba? Na baka mamaya buhok ng mais ang ilagay sa iyo, hindi mo alam. Thank you guys so much for leaving me some messages here. And guys, by the way, I just reached 1,000 subscribers. I'm so happy. Thank you guys for all your support for my friends, families, and it's been, I think, 2 years of hard work. It's not easy to get the 1,000 subscribers. You really have to put your dedications and you have to have the motivations to do it. And if you guys are new YouTuber if you guys are new to YouTube and you guys are planning to start YouTube, just be patient, okay, and do what you really want to do. Like in my case, I like to do hair loss and skincare and nursing stuff, so I really follow that and don't stop. Like just keep on going, okay. And one thing that I can say is say no to sub, okay. Wag kayo mag sub to sub, guys. dadami din ang subscribers nyo and views nyo. Just be patient, magawa kayo ng content na gusto nyo talaga. And your YouTube will reach there. Ako, 1,000, I'm very happy. I know for like it's still small, but it's a milestone for me. And yeah, like always do a content that would give people good informations. And yeah, and it's very important not to give them false information kasi kawawa naman yung mga taong manunood, di ba? Siyempre umaasa sila ng good informations and we don't want them to, like, you don't want to be fooling them. It's not nice. So if it doesn't work, tell like go and say it doesn't work. If it works, then it's good. So yeah, guys, let's talk about the shampoo that I'm using. Yun pa rin, yung Sika Peptide Anti-Hair Loss shampoos. Paubos na nga. So I'm planning to go back to Rio ginseng shampoo, which I really like it, guys. So far, okay naman yung buhok ko. My hair was so bad before, like really. It was really, 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 really bad. I don't know if I can see let me check my I think I have a video. I think I do have. Let me just find it. And I want to show you guys how my hair looks like before. Just looks so bad. Okay, I think I do have. Okay, guys. This is my hair before, okay? You guys can see that there's a big gap in here and in here. Like, guys, nakakalbo talaga. Seriously. Can you guys see? Look how bad that is. Sorry. So bad. My God. Nakakahiya. Like, seriously. Ang pangit talaga, guys. And I'm gonna show it to you guys again. Like, ang pangit talaga ng hair. Buti na lang. Like here, this area, guys, talagang luminipis siya. But now, like, pati dito talaga nag-grow siya ng ano. Grabe talaga yung changes. Like, seriously, guys, my hair has so much improvements, especially this part over here. Can you guys see? Look how many baby hairs are in here and in here too. Like, oh my God. Pag nakikita ko yung ano, like whenever I see, like every time I see this video, talagang pag minsan like, naiyak talaga. Kasi nung takot ako like I was so scared to take finasteride before. Like really, I was very, very scared. Kasi nga, naisip ko, sabi kasi nila, there's gonna be like side effects, erectile dysfunction, tapos madidepress ka, things like that. So, takot talaga ako. I was so scared, guys. But you know what? What I have learned is medications, like conventional medications, like finasteride and things like that, MINOXIDIL, they're actually not bad. Kaya nga you really have to see your doctor first para ma-explain sa'yo. I mean, the medications are there for a purpose, and it went through a rigorous study. It's safe actually. Earl Kenneth Sumok, what's your thoughts about oral minoxidil? Okay, so as I said earlier, oral minoxidil is for blood pressure. Okay, the topical minoxidil actually started after it was actually an accident. So when the patient took oral minoxidil, they actually grow hair. But the purpose of oral minoxidil is to lower blood pressure, right? So when that side effect came about regarding the more hair growth after oral medications, they came up with a topical. But I don't recommend the oral medications unless otherwise, again, prescribed by your doctor. But it is unlikely. Oral minoxidil is not for hair loss. It is to lower your blood pressure. If you have cardiac issues, oral minoxidil are used. The dosage for oral minoxidil is different than topical minoxidil. Okay, kapag meron kang hypertension or alta presyon, I should say in Filipino, oral minoxidil would help. But I will be very honest with you. I work in the hospital. We have a lot of hypertensive patients. We have a lot of pasyente na matataas ang blood pressure and may problema sa heart. I've never seen minoxidil medication sa hospital. I guess it's because minoxidil is an old medication and marami nang lumabas na ano. There are lots of different kinds of high blood pressure medications now. So I don't see oral minoxidil. But if ever, um, I wouldn't take minoxidil. First of all, I can't because in Canada it has to be prescribed. You cannot buy it over the counter. So in the Philippines, I don't know. Kasi sa Philippines, sometimes you can buy medications over the counter, right? So yeah, that's my thoughts with oral minoxidil. It is not used for hair loss. It is for blood pressure. So I hope I answered your question. So are you guys using finasteride or minoxidil right now? Tapos meron pang ano, some people, 'di ba merong what do you call this? Finasteride and cancer. Some people they said that it can actually cause cancer and things like that. I don't really believe that. Finasteride is a safe medication. I mean, if I cannot say that it doesn't it I cannot say that it doesn't cause cancer because really sometimes we don't even know the main cause of cancer, right? Some people they don't even smoke, they don't drink, but yet here they get cancer. So we don't know. Depression, I don't know. Like it's not maybe if you already have a depression, sige baka may possibility, but usually na mga nagkakaroon ng side effects with finasteride, or I should say like some people who get side effects from finasteride probably are those who already have an underlying medical condition such as diabetes, um, they're already depressed and things like that. But if you're relatively healthy, I would say that finasteride is a safe medication. And regarding the erectile dysfunction, it's less than 2% of people do get side effect from that. But we don't know those people who get side effects, as I said, maybe they're diabetics or hypertensive, or they really do have a erectile problem. But if you get a side effect from using finasteride, after 2 weeks of stopping the medication, it'll go back. You know, so it's a safe medication. That's why, as I said, always involve your doctor for your treatment. You know what, guys? The price of finasteride here in Toronto depends on how much. So this one is 60 tabs, and it cost me around $90. I don't know how much that is in the Philippines. $90, maybe around. Let me see. $90 is like 90 times 4. So it's like around 4,000 pesos for 60 tablets. Yeah. Hello, Antonio Rainier Kayako. Hello po. I'm already in my first month of finasteride. I haven't had any untoward symptoms. Very good. I'm so happy. Unlikely, yeah, so far naman, ano, karamihan naman ng mga taong nagti-take ng finasteride, wala naman talaga silang na side effects. Alam mo 'yun? I mean, I've seen a lot of patients that had taken this medication. Okay naman sila. Wala talaga ako na nakikita. You'll get more side effects from taking paracetamol than finasteride. Honestly, guys. And ibuprofen. Ibuprofen can cause bleeding. Paracetamol can cause liver function if pag lumampas ka ng 4,000 milligram daily, it can give you like a big time problem with paracetamol, Tylenol. But finasteride is very well tolerated talaga. It's not because I am promoting the conventional medicines, or I'm promoting the finasteride, but I'm just talking about its safety index. And it depends on you how you would actually look at it. Depende sa'yo kung saan mo titingnan siya. Kung halimbawa marami kang napanood na horror stories in Google or in YouTube or other search engine na na-depress sila, nasiraan sila ng bait. I guess yan yung ano sa isip mo. But ako na yung nagsasabi na safe yung medications, and if ever na magkaroon ka ng side effect, it's very, very, very mild, and it will ano magre-recover ka naman after you stop the medications. But really, wala pa talaga akong nakita. I haven't seen somebody who uses finasteride and they have really, 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 really bad side effects. Wala talaga. Like sexual dysfunctions, low libido, or erectile dysfunctions. Wala naman talaga ako na-experience, honestly, guys. And this is maturely speaking, okay? Hello, YouTube. Honestly, Antonio, I've seen, like, the first thing that I've noticed is the crown areas. Like, dito talaga. Like, seriously, dun ko siya first na notice. And then, ano, um, yung dito sa may side. Kasi ito talaga nun, like, ubos. Like, as in talagang ubos. Like, I'm telling you, it's gone. It's almost gone. Tapos, yeah, first is the crown and then the temporal area. So, hi Earl, again. Okay, so oral minoxidil. So, as I said, un- my understanding pharmacologically dito sa oral minoxidil is it's a blood pressure pill. Um, So yung question mo is, I'm taking oral minoxidil for more than a year kasi and I can buy it here over the counter, but thinking to switch back to topical. First of all, my first question is, nag-oral minoxidil ka, is it prescribed by your doctor? Or talagang inano mo lang siya? And kasi baka magkaroon ka ng problema, maraming side effects ang blood pressure medications, okay? And kapag naka-blood pressure medications ka, kailangan na mo monitor yung blood work mo, kailangan kinukuhanan ka ng dugo every certain months. Okay? So I think kung wala ka namang problema sa blood pressure mo, this is my recommendation to stop the medication. Tapos mag-topical ka na lang. And if you are seeing a result with oral minoxidil, talk to your doctor na nakakatulong sa yung oral minoxidil, can I use it? But I'm saying to you now that unlikely your doctor will be approving that to take oral minoxidil for hair growth. It's much better to switch back to topical. First of all, it's much safer, and the topical is really meant to be used and it's approved by the FDA to be used for male pattern and female pattern hair loss. So that is my recommendation, ha. Concern lang ako kasi that oral medication of minoxidil, baka since you've been taking it for a year, baka naka-experience ka na ng masyadong mababang blood pressure, especially in the morning, or medyo nahihilo ka, feeling dizzy or things like that. So switch back to topical. That's my suggestion. That is much safer also. Thank you guys for all the messages. Thank you so much. I'm trying my best to answer all these questions. Um, and yeah, actually, I'm learning also from you guys, and it's very interesting. Like yung kay Earl Kenneth about the oral minoxidil. I don't know so much oral minoxidil. I've never seen this medication, never used it, never had given this medication to patients, but it's nice to learn new things. And for Jube de Gracia Villafranca, hi Earl, is it expensive? Mean the oral minox. So Earl, Juve she has a question for you. She's asking if it's expensive and the oral minoxidil. Guys, we only have two approved medication for male and pattern hair loss. Okay, only two, guys. Two. That is topical minoxidil and finasteride. And for the ladies, it's spironolactone, or I should say three medications. Yun lang. Even the lasers are not yet approved as a treatment talaga, like FDA approved for hair loss. So that's why I am kind of discouraging you guys to use the oral minoxidil for hair loss. I know that one of the side effects is that the patients who took minoxidil, they have hair growth, but actually that hair growth was all throughout the body, hindi lang dito sa my scalp. So guys, be careful with the oral medication, the oral minoxidil. Mag-ingat kayo sa oral minoxidil, guys, okay? It's for high blood pressure. Maari di siyang maka-cause ng irregular heart rate, palpitations, bumaba yung blood pressure mo. Usually, kung bata ka pa, normal lang ang medyo mababa ang blood pressure. Imagine taking oral minoxidil, baka first thing in the morning, hindi ka makatayo because your blood pressure is very low. I really like Earl Kenneth's questions. It's very interesting. So Antonio Koyako, I hope that I answered your question regarding the crown, front, and vertex. So yeah, sa crown, and then dito sa may temporal area, and then after like 6 months, guys, makikita mo talaga yung hair growth, like improved talaga. I mean, hair shedding, guys, even with finasteride, you will still have that, hair shedding, but it's within normal, I should say. Hindi mawawala yun. The hair shedding will always be there, even with finasteride and minoxidil. Okay, guys? So, don't think na mag-aano siya, like totally stop. Hindi. But compared to when we first started the finasteride, much better siya. Because remember, the times when we were starting to have hair loss, especially before the medication, whenever you take a shower, sobrang dami talaga ng lagas. With finasteride, after few months, mas lessen yun, as much more hindi ka na stress. Okay? Have you used Topic hair fiber? No. I will be honest with you. I've never used Topic. And I know this product. My friend uses it. I don't use it. Kasi one time ang nangyari, yung kaibigan ko, he used the topic fiber and then umulan. Kita mo talaga the whole face para talaga siyang ano, sa dako. As in, nagkalat talaga yung ano. So I don't like those things. But I think it's good to like if you're going to a party or things like that, just to 7 viewers. Thank you guys so much for coming in into this live video. This is the longest live stream I have done actually. Thank you, Antonio, Jubes, Earl, for coming in and for sending me message and things like. I'm learning talaga. So do you guys want to see again the? Oh, guys, by the way, before I started using minoxidil and other topical products, I used to use a Canadian brand of like herbal solution because I was so scared to use the finasteride at first. So I used this brand. I will show it to you guys. So this is the topical product that I used before. So it says hair loss to prevent hair thinning on. So I used this for like 3 months. And guys, seriously, this one is so bad. I'm so sorry if the company's watching me. I'm so sorry, but this product is actually bad. I still have it because my cousin, he lives in the Philippines. Last time I went to Philippines, I actually brought this there, and he liked it. He doesn't have any hair loss problem or things like that. He just used it because in the Philippines sobrang init. So when he used this, it was very cooling. So at that time nag-brown out sa Philippines. So ang ginawa niya, very smart kid, ang ginawa niya, nilagay niya to dun sa scalp niya kasi walang electric fan. So yung buong hair niya lumamig. Tapos nakatulog talaga siya. He slept the whole night. So he asked me to buy him another one just for him to use whenever there's brownout in the Philippines. Hi Kito, how are you? Welcome to my channel. By the way, my name is Moe, and I do a lot of skincare, hair care, and nursing videos, content, and things like that. Welcome to my channel. So your question is, have you tried salon treatments like hot oil or spa treatment? I have. Actually, I have. Here in Toronto, I will show you the video. It's very funny. Um, that treatment, it was I think 3 years ago, and this was the time when I was so scared to see a dermatologist because I know that they were gonna prescribe me finasteride, and I'm scared to take finasteride. So I went to a natural spa treatment, and what they did was they massaged my hair. They wet my hair, of course. They massaged my scalp, and you have to go through sessions, and nothing happened actually. I was just having so much hair loss, and then they said that they use like herbal solutions and things like that, but of course it didn't help, and no, whatever. And your other question is, have you tried Novo Hair Scalp Solution? No, but I know this is a Filipino brand, di ba? I think it helps. It has sika ingredients, it has saw palmetto, and it also has caffeine, if I'm not mistaken. I saw the product. Nakita ko yung product eh. So, my my thoughts on Novo Hair, it's herbal solution. Para din siyang Sika Peptide Anti-Hair Loss. So, this is the solution that I'm using, Keto. Para din siyang ganito. It's just that this is Korean brand. So, basically, support lang siya. Okay, herbal. Wala kasing masyadong evidence with herbal solutions. I mean, may studies pero konti lang yung evidence niya. It's not part of a treatment. So, maganda ang Novo. Okay, correct me. Maganda ang Novo kung nakagamot ka na. If you're already using a medication such as finasteride or spironolactone, having to add that herbal solution is really, really good. Yeah. What's the next question? Hello po, how much is the doctor's fee to be able to get finasteride prescription po there in Canada? Oh, JV Vinyas, I'm so sorry. I read your message last time in my Instagram, but I was at my work. I was doing night shift, so I'm so sorry I couldn't reply. But anyways, welcome to my channel. And uh, in Canada, if you're immigrant or if you're Canadian citizen, consultations with the doctor, surgery, heart surgery, brain surgery, whatever, it's free. Okay, we don't pay anything. Ganun ang kalakaran ng medical dito sa Canada. The only thing that we pay is medication, but a lot of times medications are also free. Yeah, so ang consultation dito sa Canada is free. You don't pay as long na Canadian citizen ka, you're an immigrant. But if you are coming here as tourist or a student, and if you're gonna go for a consultation, you have to pay a lot of money. And I heard you told me that you're gonna be coming here in Canada. So by the way, my cousin, she's watching right now, Juve De Gracia. She's also currently on her application here in Toronto. So I'm praying that she'll be able to come here safely. And yeah, yeah. So it's free. It's a free consultation here, guys. By the way, I'm drinking iced coffee right now. This is from Tim Hortons. Tim Hortons is a Canadian brand. We do have Tim Hortons dyan sa Philippines. Very expensive and just something to be proud of. Canadian coffee, guys. I really like it. Kanina ko pa to binili, kaninang tanghali, tapos naubos na yung ice. Oh, really? Wow, BC is really nice. Congratulations. 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 Hope to see you. I haven't been to BC, but I would love to go to BC. It's like 4 hours by plane here from Toronto. Alam mo naman, Canada is very big, right? So guys, I hope na I'm answering all your questions with, medyo mahirap nga lang talaga yung sobrang information overload, but hopefully naman nasasagot ko yung mga questions nyo, and thank you guys so much for being here in my channel. I have reached 1,000 subscribers, and thank you guys so much. It took me 2 years to reach 1,000. It's very hard kasi working full time and then studying. I still I went back to university and continuously studying, tapos working full time, tapos doing YouTube. It's not easy, it's hard, but you guys are, thank you so much. Thank you, thank you, thank you. And I promise you guys to update you with my finasteride and minoxidil all the time, and skincare. Kung meron kayong family, sisters, brothers na gusto ng skincare, I would always give a highly recommended product. Hi Kito, I tried Novo Hair, bought the bundle pack, nothing happened to. I hated the scalp lotion spray, just saw the Novo Hair shampoo, which was really good. Do you know any sub I can use, which is same with the Novo shampoo as Novo is? Do you know any sub I can use, which is same with Novo shampoo as Novo is? Okay, what do you mean? Like, do you want to try? Do you want to know like a specific shampoo or hair loss solution like that? Because when it comes to shampoo, you can also check out my videos with the some of the hair loss shampoos that I'm using right now. And in terms of solution, try the Cicapeptide anti-hair loss. Alam mo kung bakit? Sub I can use which is cheaper. Cicapeptide anti-hair loss. Like seriously, Cicapeptide anti-hair loss talaga, I think is ang nagustuhan ko kasi sa Cicapeptide anti-hair loss keto, the difference with Cicapeptide anti-hair loss compared to Novo. Ang Novo kasi lahat ng ingredients niya is herbal. To be honest with you, herbal ingredients, wala naman kasing masyadong evidence na nakaka-promote siya ng hair or nakaka-regrow ng hair. Business yan eh. Alam mo yun? Like ito, I'm not promoting this product, but I'm just saying na ginagamit ko kasi naka-medication na ako. Like, I'm already using this medication, which is ito talaga yung yung result ng buhok ko ngayon. Pero dahil pinili ko na merong additional support, gumamit ako ng herbal at saka ng minoxidil, di ba? So, yun, understandable yun. Pero kung hindi ka gagamit ng gamot, walang kwenta to. Lalo, yung Novo kasi, puro herbal talaga siya. Eh ito, may salicylic acid siya, kaya ako nagustuhan. Ang salicylic acid, proven yun na medication talaga na nakakatanggal ng mga dead skin cells, exfoliations, and things like that. Kaya ako nagustuhan ang Sika peptide. And it took me a while to find you know, a good herbal with conventional medicine. Yung Novo Hair, I can compare Novo Hair to this one over here. This is a Canadian brand na puro herbal talaga siya. Hindi din to gumana, like wala talagang gumana. Anong nangyari pa? Whenever I use this, bumibigat siya sa buhok and you get these white residues, and then ang nangyayari, pag binanlawan mo, after showering it, nanlalagas lalo. So, this is not good. I'm giving this to my cousin just to cool his head down. So, I will advise Kito to use minoxidil. Approved yun. Yun talaga, gamot talaga yun. Last question. Have you tried or what are your comments with peptide serum of the ordinary? A serum for the hair made by the ordinary. Oh, yes, nakita ko yun. I think it's good. I think it's good. Nakita ko yun eh. Yung ano na yan. Peptide is good. Again, para din siyang ganito. And I think it really works as a support treatment. Kumbaga, paano ko ba ipaliwanag? Halimbawa, nagagamot ka for diabetes or high blood pressure. Para mas gumaling ka or things like that, dadagdagan mo siya ng healthy fruits and vegetables, right? So parang ganun din yun. So talagang ang pinaka-foundation mo is kailangan mo pa rin siyang maggamot. But Novo Hair and the ordinary, they're good. They're also good basta nakagamot ka na, basta you're on the medications. Peptide is actually very good to help build keratins and things like that. So I wouldn't stop you guys from using it. It's just that kasi ang hair loss, 'di ba? Okay, paano ko ba paliwanag 'to? Ang hair loss kasi mabilis manlagas ang buhok, 'di ba? So isasakripisyo mo ba na mag-take ka ng herbal kaysa maggamot ka? Eh kung hihintayin mo ang herbal gumana, baka by that time lagas na yung buhok mo, hindi pa rin gumagana. So the best is mag-take ka ng gamot. 100% it's proven na ang gamot talaga is gagana, and then dagdagan mo na nito kapag stable na yung hair loss mo and ang hair growth niya is much better kasi may support. So yun ang yun ang recommendation ko, yun ang understanding ko kasi ayoko namang ng tao, di ba? Ayoko magsabi na, oh, Kito, gagana talaga to. Kumain ka ng kalamansi or mangga. So, my question is with you, are you having hair loss right now? Like, do you know the type of hair loss you're having? Kasi maraming iba't ibang klase ng hair loss. That's why what I always ask you guys is to always see your doctor first to see what kind of hair loss you guys are having. If you guys do not have a male pattern or female pattern hair loss, there's no way that the finasteride or spironolactone would work. If your hair loss is due to anemia or thyroid, yes, sir, I guess it's receding hairline. It's receding a hairline. It can maybe male pattern hair loss or female pattern hair loss, pero hindi natin sure. Doctor lang ang makakasigurado nun, di ba? So, kailangan pa rin talagang makita through blood, kailangan makita sa dugo. And then pag sinabi ng doctor, okay, Kito, meron kang male pattern hair loss, finasteride na yon. O may female pattern hair loss ka, spironolactone na yon. So at least kampante ka na yun talaga yung mo. Eh paano kung yung hair loss mo is due to thyroid o may problema ka dito sa thyroid mo? hindi gagana ang minoxidil or ang finasteride. Kailangan mong mag-treat. Kailangan mo ng gamot for thyroid. And then pag okay na yung thyroid mo, tutubo na uli yung buhok mo. Yun kasi yun. Kaya napaka-importante na magpaano muna. I know na a lot of you guys are scared, including myself. I was so scared to seeing the doctor. And aside from that, in the Philippines, seeing the doctor is very expensive. I totally understand. So, but I think there are some agencies like Philippine Dermatology, something I think you guys can go and check. May mga libreng consultations sa Philippines. I'm pretty sure. Hindi naman tayo ganun kakulilat sa healthcare, I think. Possibly. Oh, you're very welcome, Kito. I hope I answered your question. I know medyo complicated pag minsan, but kung gusto mo talaga ng result sa hair mo, doctor, medication, and then kung gusto mo siyang dagdagan ng support, pwede ka nang mag-herbal novo or herbal ano pa ba? The ordinary, pwede ka nang mag-ganon. Basta alam mo na yung cause ng hair loss mo at saka nakagamot ka na. So, ganun yun. So, sabi ni Antonio Rainier, I think it's male pattern if you have a family history of baldness. Pag minsan, meron tayong hair loss kasi may family history tayo ng diabetes or thyroid problems or autoimmune problems, yung mga ganun. So, kaya kailangan talaga masuri ng ayos ng doctor, right? Thank you guys so much for coming in. Today is July 6 here in Canada. I know it's July 7 na ba dyan sa Philippines? Hindi pa. Thank you guys so much talaga. I really enjoy this thing kasi alam mo masarap magbigay ng information kapag experience mo talaga. Like for example, ako na-experience ko talaga ang 2 years of finasteride and 2 months of minoxidil. So masarap mag-explain kasi na i-share mo yung talagang experience mo with this medications, di ba? So I'll keep on doing that. I update ko kayo lagi ng i-update. So guys, kung hindi nyo pa ako napa-follow, is this a live recorded? Will you post this video? Oh yeah, I will definitely post it live. It's gonna be part of my live playlist. So by the way, Kito, hindi ko yata napakita sa'yo. I haven't showed you my box of minoxidil. So this is yung product na minoxidil na gamit ko. So ayan siya. This one is a Canadian brand. So this is my 3rd bottle. Okay? 2 months na akong gumagamit kasi madali siyang maubos. Madali siyang maubos because I use it really every night. Ganun ako gumamit ng medication. I make sure that I use it consistently because hair growth is very complex and it's very slow. So you have to be consistent with your medication. So ito talaga yung ginagamit ko. This is the 3rd bottle. Ayan o. So, ang nasa loob niya is this one at saka yung ito. So, pwede mo siyang palitan ng either this one. This one goes directly on your scalp like this. And then this one over here. This one is yung gamit ko, spray. I like the spray one kasi pag gini-spray mo, it covers like a big, surface. Tapos ito kung gusto mo like specific area, kung gusto mo dito lang siya sa may temple, you can use this one. Like that. This is $45. So roughly like mga around 2,500 pesos, I think. So Jubes, si Jubes ba yung nag-message kanina? No, actually, are there any side effects you experience while using minoxidil? Honestly, wala talaga ako na-experience. Di ba yung iba, some people would experience like scalp itching, dryness, redness. Wala talaga akong na-experience so far. Well, it's been 2 months only, and besides, minoxidil is very safe kasi it's just topical. I mean, sa surface lang naman siya ng ano mo ng scalp mo. So, it's a very safe medication. So, it's unlikely that you'll experience. Maybe the most common one is scalp irritation. That's why I started with 2% solution. We have 2% and 5%. I started with 2% solution because um, I'm monitoring myself, making sure that I don't have any, I don't get any side effects. But it's a safe medication, so yeah. Guys, this one talaga nakakatawa talaga to. Like, yung consistency, maganda siya, mabango. Do you still recommend do you still recommend your past minoxidil products that you have used, like the Rogaine brand? I think Rogaine brand is there's. I mean, this is the first minoxidil product that I have used. It's been 2 months. Like really, first of all, it's cheaper. Rogaine is very expensive. Like 3 bottles, I think parang nasa $90, almost. Um, it's $90. It's very expensive actually. Yeah, Rogaine is good. Rogaine is good. It comes with foam. My foam, actually, they recommended me to use the 5% foam. I just refused to use it because I wanted to start something lower, 2%, and it was planned actually. I um, I told myself that I'm gonna do minoxidil. I'm gonna use minoxidil after 2 years of finasteride. This hair loss problem thing is very very common, eh, even like everywhere. Ang hirap, honestly, with hair loss, napakahirap niyang solusyonan. Ang hirap, like, the fear, the the products that you're gonna be using. Pero guys, don't be confused, okay? I mean, don't be scared with going through your consultation with your doctor. It's much better to be seen by your doctor, rather than buying stuff over the counter and you don't know the cause of your hair loss. So guys, I highly suggest that you see your doctor first before anything else, before buying over the counter products. And I will be saying that over and over and over and over again, all throughout my videos and all throughout my live stream videos, because that's how it should be. I mean, the doctors, you know, yung iba nga ano eh, yung iba nga sabi nila, yung mga doctors daw is nagagalit and things like that. Yes. Oh, no problem. Anytime, Kito. Thank you so much. Guys, thank you so much for coming and thank you so much for leaving comments and asking me questions. I know that I cannot really answer everything, but I'm trying my best to answer them. Follow me guys on my Facebook. Actually, gumawa ako ng bagong Facebook page. I'm pretty active there. Tsaka ng Instagram ko. Yung sa Facebook page ko, it's about nursing and skincare and hair care. So doon ko rin pinopost lahat ng mga daily ano ko for hair loss and skincare, mga bagong sunscreen products or things like that. Kasi ayoko ba yung yung anong tawag dito? Yung gagawa ko ng video sa sasabihin na, oh, gamitin mo yung gamitin mo tong dahon ng malunggay, tutubo buhok mo. Hindi talaga ako naniniwala dun. Tapos 'di ba meron pa ngang ano, some people they would even promote onion juice, like onion juice girl. Seriously, tapos pakita nila before after onion juice. Girl, gusto I don't know. Like bahala na kayong humusga guys, but onion is very healthy for your health, okay? It's good for your cardiovascular, it's good for your liver, it helps support immune system. But juicing it, yung i-juice mo siya and then you put it on your scalp. Come on, like seriously, hair loss, majority of hair loss problem is genetics. And pag genetics ka, it's genes and hormones, of course. There's no way that an onion contain as an onion that contains sulfur in ingredient would block DHT. Wala talagang evidence. Alam mo 'yon? Kung gusto niyo mangamoy yung scalp niyo na amoy onion, go ahead. But I, I wouldn't recommend that. My dad also told me to try onion, but it never did because the smell and there's no scientific study. That's why. But thank you, Dad. You should tell your dad because alam mo, our parents, they'll always they want the. It's not your dad's fault to be telling you that onion juice helps. It's the grandparents actually. Pero take note, long time ago, um, yung mga parents natin, hindi naman kasi masyado nakakalbo nun eh. So they don't know so much about the medications and stuff like that. Ngayon, mas marami ng alam ang tao. Yes. 'Di ba? Ganun yun. Grabe guys. You know, when I was having my before I started Finasteride, I was so shy to go and see the barber, like seriously. But now I'm so confident, talagang ginagawa ko yung buko. Cut my hair, cut everything. Alam mo yon, yung hindi ka na natatakot. Like ubusin mo lahat, tutubo uli yan kasi naka-finasteride ako. Noon eh, pag nagpapagupit ako, sasabi ko sa barber, oh, sir, konti lang, konti lang. Alam mo yon, paunti-unti lang dito. Dito wag dito. Oh, not so much here, not so much here. Ganon. Ngayon eh, go ahead. Cut everything. I'm on finasteride. It's gonna grow back. Ay, ayun. Sabi nila, they said that vitamin D, if you don't have enough vitamin D, it causes hair loss. Sa Pilipinas, ang daming vitamin D. Okay? Halos lahat ng Pilipino may vitamin D kasi ang lakas sa sikat ng araw, pero may nakakalbo pa rin. So, anong ebidensya doon? Diba? Sabi nila kasi dito sa Canada, napapanot daw yung mga tao kasi wala daw vitamin D. That's not true kasi marami naman akong nakikita dito mga matatanda. Ang kapal ng buhok nila eh. We have 9 months of winter here and hindi naman sila nakakalbo. Sa Pilipinas, maraming araw pero may nakakalbo pa rin. So, nasan ang ebidensya doon, di ba? So, yeah. Are you guys currently what are the shampoos or conditioners that you guys are currently using right now? Please no, babaho ang pillow and kumot mo. Yes. Guys, I tried Peg Grow aloe vera. I highly do not recommend Peg Grow aloe vera. What's that? Aloe vera is good for sunburn. Aloe vera helps to moisturize pero malagkit sa hair. It's very sticky on the hair. I do not recommend aloe vera also. And yeah, but aloe vera is very good for post-sun damage. If you got sunburn or things like that, it has, I guess, antibacterial, it's good for those things. But for hair loss, really, hair loss, as long as you know the cause of your hair loss and you are well diagnosed, then you can go ahead with your medication. Guys, don't forget to share my channel to your family and your friends who's also having hair loss and things like that. And then if they are into skincare, hair care, whatever, please share this channel to them. And thank you guys so much for your support. I really, really appreciate it. At first, it was so hard. Like, seriously, should I do a hair care video? Like, who's gonna watch it and things like that, you know? But I'm very happy. Yeah, herbal is good. Like, say for example, if you have like sore throat, cough, or things like that, herbal may help. Okay, but in a lot of medical conditions, it doesn't help. Like, it doesn't, seriously, it doesn't, it won't. I don't know. I don't know what I should say. Oh, thank you so much, Jube, for joining in. I think I was just talking to you in the video call the other day, right? Do you guys have any more other questions for me regarding hair loss or things like that? May mga questions pa ba kayo? I'm gonna end this video soon. It's been like, I think, almost 2 hours. Oh my god, this is the longest live streaming that I have done. And yeah. Oh, salamat, 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 salamat. Next na live videos ko, I will share with you guys my gusto niyo ba makita yung ano? Do you guys want to see the shampoo that I'm using right now? But I think I've showed it already. Pero kung gusto niyo makita yung shampoo na ginagamit ko ngayon, I can go and grab it quickly and show it to you guys. Medyo paubos na yun, but I can still show it. Yun yung video na ginawa ko 2 days ago. If you guys want to talk about it, that's fine. You can just let me know. I can get the products there. It's in the washroom. Nakatulong naman yung ano, the shampoo really helped. But, you know, again, as I said, it's a herbal shampoo. It's good to support treatment lang siya. Don't use the thing. Don't, like, wag nyo talagang unahin ang herbal kapag may hair loss kayo, guys. Like, remember in the Philippines, they use the malunggay. They crush the malunggay. They make it into a, what do you call that? And then they pahid-pahid on your, they will pahid it on your scalp. Especially if you have alopecia areata, 'di ba? Sa Philippines may alopecia areata is pretty common. Alopecia areata is in Tagalog we call it poknat. Ang poknat, poknat is an autoimmune, okay? Ang ibig sabihin ng autoimmune is yung sarili mong resistensya, yung sarili mong immune system, inaatake yung hair follicles mo. So, anong nangyayari? Nagkakaroon ng poknat na gano'n nalalagas. So, ang ginagawa nila, binibigyan nila ng ini-inject yun tinuturukan yun ng dermatologist na corticosteroid, ko hindi ako nagkakamali. Tuturukan yun, and then, proven yun, after 2 weeks, mag-grow yun. Balik na uli sa normal. Pero kahit naman pag minsan, even if without the medication, ang poknat, bumabalik yun. The problem is with gagaling naman yun. But the problem with POCNAT is if it happens again, sometimes they tend to be much bigger. So, babalikan na naman to your dermatologist and then tuturukan uli nila yung scalp mo. Kasi nagkaganon yung kapatid ko. Sabi nung grandparents ko, lagyan mo ng put malunggay or onion juice. Sabi ko, wag na, dalhin nyo na sa doctor, So, in-inject lang ng doctor ng um, corticosteroids. Corticosteroids na ba tawag? Oo, yata. Yeah. Maliit lang na needle yan. It's a small needle. They inject it in your scalp. Oh guys, you know what? There's this product with Head and Shoulder that my dad gave me. I didn't use it, but I wanted to show it to you now. Guys, this is the product. Can you guys see? This is by Head and Shoulder. Can you guys see it? Ano ba yan? Nawawala yung beauty zoom ko. Anyways, this is by Head and Shoulder. This is by Head and Shoulder. So, ano siya? Tonic din siya. Para din siya, like spray. So, this one is, I don't use this. Seriously. I don't use it kasi for me, like, Head and Shoulder is much more effective as a shampoo and conditioner. But as a tonic, I don't know. The main ingredient of this product is caffeine. Okay, caffeine talaga. Like, how do I do that? Caffeine. Yan, that's the main ingredient of this product. Ang caffeine kasi, there's some studies that if you use caffeine, if you use caffeine like topically, ini-energize niya yung hair follicles mo. It produces so much energy. Tapos magpo-promote ng circulation and then it will boost hair. But still, the studies are still very limited. I mean, it's good for you to use it. You can try it. Malamig siya sa scalp. It has a very cooling effect. And what else can I say? I used it for 2 weeks. Of course, 2 weeks is still too early and you wouldn't really see any result. But there you go. Head and Shoulders for men, full and thick. Sorry. Advanced Thickening Tonic. If you guys want to, sabi nila na 2 times fuller and thicker hair daw. So after, paano ba to? Sabi nila after certain months daw makikita mo yung after 2 weeks yata, makikita mo yung result. Hindi ako naniniwala. Like, I don't believe it, seriously. But anyways, if you guys want to know, lagay ko yung product name dito sa baba. So, lagay natin Head and Shoulders. So, you guys can do a research on this. But, again, herbal. So, it's just a support, Advanced. There you go, guys. So, yan yung product. Actually, alam nyo, I'm gonna put all the products that I'm using here for you guys to go and check out also. Yes, of course. Can I use minoxidil while using herbal shampoo? Okay, first question. Can I use minoxidil while using herbal shampoo? Of course. Mas maganda nga yun eh. It's better actually kasi ang herbal shampoo kasi it helps then to exfoliate, especially if the herbal shampoo that you're using has a very good ingredients such as salicylic acid. Yung shampoo nito, oh, you know what? Let me get the shampoo. Wait. Okay. Okay, so yung first question is, can I use minoxidil while using herbal shampoo? Of course, you can. So, especially kung yung herbal shampoo na ginagamit mo contains ingredients called salicylic acid. So, as I said, salicylic acid is a good exfoliant, di ba? Nakakatanggal siya ng dead skin cells. So, ito siya. So, yan yung shampoo na ginagamit ko. Herbal to. So, meron tong, it removes dead skin cells. Meron siyang cicapeptide at saka may nutrients din siya. So, gagamit ko after nito, gagamitan ko siya nung conditioner. So, ito yung conditioner na ginagamit ko. Medyo maliit lang to eh. This is pretty small actually. This is Cicapeptide Anti-Hair Loss na Dermascalp Treatment. So, this one is parang conditioner siya plus leave-on hair mask. So, meron tong zinc pyrithione. Yun yung ingredient nung Head and Shoulders. So, kaya ko siya nagustuhan kasi may zinc pyrithione. And zinc pyrithione is actually a common anti-dandruff. So, tinatanggal niya rin yung mga dandruff mo. Pag nalinis mo na yung scalp mo, once your scalp has been cleaned, well cleansed, after a few minutes, spray mo na siya ng minoxidil. And I'm telling you, the absorption, it's much better. It's really, really good. So, ganun yung ginagawa ko. And the second question is, can I use minoxidil and still use my hair serum? Can I use minoxidil and still use my hair serum? Yes. My advice to you is when you use your minoxidil, wait for like maybe half an hour and then use your hair serum. Prioritize the medication first. Let it get absorbed and then use your hair serum, whatever it is. Medication first and then your herbal support. Do I use serum first, then minoxidil and spray? Or no, use your minoxidil first, always. And then maghintay ka ng half an hour para ma-absorb. So gawin mo, minoxidil, spray mo, cover mo siya ng towel or if you have like a shower cap. And then after half an hour, gamitin mo ng hair serum mo. Doon, ano siya, at least may support ka, di ba? Medication support, ganun. Yun ang ano ko, yun ang recommendation ko, yun ang advice ko. Jubes, nandyan ka pa ba? Guys, follow me on Instagram, okay? Thank you so much, Kito, for those beautiful and very interesting questions. I think I should be doing a lot of this. I like it. I'm enjoying this actually. Hindi ba malabo yung yung sa camera? So, guys, by the way, the conditioner that I'm using right now is this one over here. Love this. Love it so much, guys. I really love this. This is the brand from Rio. This is very cooling. It has ginseng. So, iba naman to. This is a little bit different than the hair loss shampoo that it's different than the Cicapeptide Anti-Hair Loss because Cicapeptide Anti-Hair Loss has a salicylic acids. It's a little bit mixed with conventional medicine. That's why I like this. This one is pure herbal. May ginseng siya. Ginseng is also very good. I like this. So this is a Rio Deep Cleansing and Cooling Conditioner. Very nice actually. It's an anti-hair loss shampoo also. You guys can try that. Guys, it's summer here in Toronto. It's very hot. By the way, we only have 3 months of summer here. So all throughout the year, we have cold season. Winter, yung winter namin is very strong, like very harsh. Sometimes it gets to until minus 15 degrees. So very, very cold. That's why I'm very excited to go to Philippines to experience the heat, the summer, the humid weather, the beach. I'm going back this October. Yes, I know. Guys, by the way, Juve sent me a message in my Facebook. She's telling me that this is my longest live streaming ever. So I told her, yes, I know. Guys, is Hairmax laser comb popular in the Philippines? I don't know. Is it popular in the Philippines? You know what, guys? Laser comb really helped my hair a lot, like a lot. I have this for like 17, 18, 19, 20, 20. Oh my gosh, almost 5 years now. I really like it. It's really nice because you get to remove this. And what I like about this one is it helps to partition your hair, which is good. So also one thing that I do is one thing that I do also is I use the after using minoxidil, I then apply this one. Thank you guys so much for your questions in regarding hair loss. Okay, keto. So let's see. Having thinning hair and hair loss, I decided to stop using conditioners. I noticed my hair getting, yes, I noticed my hair getting more down, like no volume. It does help with the single shine and smooth or soft feeling. You know what? You know what, keto? When I was having hair loss the first time or the first few months, Of course, I was having a lot of hair shedding. I never use. I was so scared to use conditioners. I've noticed with the conditioners, it makes the hair shedding even worse. That's what I noticed with the hair with conditioners. I don't know why, but I think there's this with conditioners that it makes your hair very slippery. What do you call that? Like it makes your it has an ingredients that softens your hair so much that it becomes so weak. I don't know, but that's my experience with conditioner. So when I was having hair loss, conditioner makes my hair shed even more. I don't know if you're also experiencing that. I also was using conditioner wrong since I applied directly to the scalp when I should apply it pala on only on the end of my hair, not the scalp. Depends though. Some hair conditioners, like especially like hair loss conditioners, such as this one. This one it actually instructs you to apply the the thing on your scalp because the hair loss is in the scalp, right? I mean the hair loss problem is really in the scalp, so you have to like really massage it on your scalp. And sometimes um if you're in that stage of hair loss, it makes the hair worse. That's why I don't use hair conditioners before, but now I use it. Like I'm so confident with using hair loss conditioners. Yeah. Kito, are you in the Philippines? Are you Filipino? Well, yeah, you use Tagalog, so I'm pretty sure you are. Or you know how to speak Tagalog? Yeah, conditioning makes hair. That's why I don't use it. But the problem is sometimes when you only have to use shampoos, some shampoos actually makes our hair dry. That's why conditioner is very important. Yeah. So guys, again, as I always say, consult with your doctor always. What time is it now in the Philippines? It's 11 o'clock, right? Yeah, it's 11:08. Okay. Tiyaga ni Jubes ah. Oy, ito yung pinakamahaba, girl. 2 hours talaga. Well, I'm okay with it. Guys, again, thank you so much. Thank you so much for coming in and asking me questions regarding hair loss. I haven't done a what do you call this? I haven't done a skincare live streaming before. I don't know. Honestly, guys, I do a lot of skincare videos, but skincare is I'm not really I am not specialized in skincare or things like that. I mean, in 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 my workplace, skincare is very important. But what I mean by the use of skincare in my workplace is really to prevent further, to maintain the function of the skin. It's not for beautification or things like that. So if the patient has dry skin, we give them, for example, um, a specific skin medications like urea, 22%, Vaseline. Those are the medical skincare. So the beauty skincare is really different in the medical perspective or at the workplace, like really. Bye, Kito. Thank you once again. See you in next live. Oh yes, of course. Thank you so much again for this opportunity. I'll see you again on my next live, of course. And don't forget that notification bell so you're always updated. Nakakasakit ng batok din, ano? Ah, thank you. Oh, Jubes, ikaw na naman ang natitira. Talagang nakagano. This is the longest live streaming. Guys, thank you so much again for watching and for leaving me some comments and questions and things like that. I think I may have to end this video now. It's been 2 hours. I still have to do some stuff. It's late at night. It's 11:12. I'm still gonna go and check my homeworks and see. But again, guys, I will keep you guys posted and I will see my schedule when I can do another live streaming for hair loss and of course partly skincare. Thank you guys so much. Again, I will repeat this for the millionth time. If you're having hair loss, do not go and just jump into buying stuff over the counter. Always see your treatments for proper assessment and proper diagnosis. Okay, there's a lot of causes of hair loss. It can be from stress, it can be from vitamins, mineral deficiencies, thyroid, anemia, genetics, of course. So it is very important to be ruled out by your doctor and see from there what you really need for your hair loss. Okay, guys. Anyways, thank you so much for watching again, and I hope that you enjoyed this live streaming. So, guys, if you like this live streaming, give it a thumbs up, turn on that notification bell for more updated videos such as this one. And of course, I'll see you guys again next time on my next videos. Bye bye.